Hello, my name is Sarah Breakey, and I will be going over the developmental course of Alzheimer's disease. This disease slowly progresses in severity through three stages as age increases. The three stages are mild, moderate, and severe. Stages can overlap and symptoms can vary in severity between patients. There are two types of Alzheimer's disease, early onset and late onset Alzheimer's. Late onset Alzheimer's affects patients in their mid 60s and is the most common form of Alzheimer's. Early onset Alzheimer's appears in patients between ages 30 to mid 60s. On average, patients live between 8 to 10 years after diagnosis and can last up to 20 years. In preclinical stages, researchers can use dyes and PET scans to identify plaques and tangles which cause cognitive decline. Brain scans can detect the disease before symptoms are present. However, it cannot always predict the progression of Alzheimer's. The first stage, mild Alzheimer's, patients appear to be healthy, however, experience minor memory lapse and have challenges navigating and making sense of their environment. These challenges include memory impairment, repeating questions, misplacing objects in odd places, and poor judgment. Patients become withdrawn from interests in social events. Treatments include challenging the brain and encouraging patients to expand on the working memory and to maintain independence for as long as possible. Stage 2, moderate Alzheimer's, generally the longest stage in this disease, lasting multiple years. Signs of advancing to the next stage are determined with tests and overall decline in memory. Patients often forget details of their own past and information about themselves, including their phone numbers, addresses, and names of towns they once lived in. Experience increase of anxiety and suspicion, to have difficulty recognizing relatives and in some cases their own spouses in some severe cases. Confusion and the risk of wandering increases. Supervision and involvement of family becomes more recommended, and minimizing changes can help limit confusion in their daily lives. The last stage, severe Alzheimer's, all overall health has deteriorated and patients' motor functions are limited. Assistance and daily activity is needed. Symptoms include trouble speaking, swallowing, loss of body functions, along with increased sleeping and weight loss. Patients experience difficulty communicating their needs and understanding others. Inability to remember details of personal history and recognize faces. The leading cause in Alzheimer's is aspiration pneumonia, and this is caused by inhaling food and liquids into the lungs due to difficulty swallowing. And this shows a healthy brain next to a patient with severe Alzheimer's. And you can see the formation of plaques and the overall deterioration of cortex, which caused the lack of memory. Treatment, since this disease progressively gets worse and there is no cure, the treatment focuses on maintaining the brain functions that they still have with using inhibitors, which can be used in all stages and helps improve the communication between neurons. Medication alone does not have a significant effect on treating Alzheimer's. Treatments focus on improving cognition to help prevent depression and insomnia. Environmental manipulation, family support, along with other medical support can help minimize the presence of symptoms in Alzheimer's patients. Maintaining independence in patients is key in treatment, such as keeping them in their homes, utilizing written reminders, and maintaining healthy practices like exercise and hydration on their own can go a long way in extending the stages. That's it.
My name is Savannah, and today I'll be talking about the behavioral and cognitive manifestations of Alzheimer's disease. So, the first group of symptoms, which classify as cognitive dysfunction, are forgetfulness, which is not being able to recall dates or events as they used to, misplacing things, so they might lose items such as their keys, wallet, or phone, and problems speaking or writing. Alzheimer's may cause difficulty speaking, as well as problems with grammar, spelling, and punctuation. Next, the second group of symptoms, which are classified as psychiatric symptoms, include depression. So, people with Alzheimer's may not want to leave their house and engage with other people like they used to. They'll have hallucinations, so they may hear voices, see faces, or smell something that isn't there. They can have delusions. They may believe someone is stealing their things, someone is lying to them, or that the police is following them. And they could have agitation, so they may become restless or become upset in certain situations. The third group of symptoms are difficulty performing daily activities like driving, shopping, eating, swallowing, dressing, walking, and handling money. I will now show a video from All Health Go just to review the signs and symptoms and give a few more examples.
Alzheimer's disease falls under the dementia umbrella. It causes a slow decline in memory, thinking, and reasoning skills. There are 10 warning signs and symptoms that the Alzheimer's organization put together. Doctor, if you will, let's go through these one at a time. And if you would, mention if this is also a typical age-related change and how someone can tell the difference.
Right. So the first thing, as I was saying before, if you forget where your keys are, that's not such a big deal. But if you, like I say, leave the car keys in the car, or the car running, or water running, or the stove on, and leave the house, that's a little more significant. And again, we talked about planning and solving problems as part of it. Difficulty completing familiar tasks. So if somebody can't remember how to turn on the washing machine or turn on the television, that wouldn't be an example. People obviously can get disoriented to time or place. They may not know where they are, what year it is. And we also touched briefly upon seeing people's faces. They may not be able to recognize people's faces. And again, just in terms of spatial relationships.
There's a few things here that we didn't really touch on. Poor judgment is part of it too, and you withdraw from your work and social activities, and the change in mood and personality. I think number 10 is a big one because I have had firsthand experience in seeing that happen.
Yeah, a typical story is somebody used to be a very nice person. Now they're being aggressive towards family members and losing their temper easily. That can be a clue to dementia.
How do you diagnose Alzheimer's, though, with so many symptoms?
It's very hard to diagnose. There's no blood test for it. There's no X-ray or MRI results that are classic for Alzheimer's. Really, you have to spend time with the patient and go through a whole complex series of testing. Usually it takes a few hours and is often done in hospital centers that specialize in dementia.
Here's my works cited.
Hello everybody, today I'm going to be doing my part of the presentation on the neural and genetic aspects of Alzheimer's and what they can bring to, and what they do on an individual. First, let's go over how do Alzheimer's affect a person's neural cognition. The brain has a lot of different chemicals held within it, which are able to make a body receive the message from the brain. These signals stem from a billion neurons that have specific jobs. Alzheimer's disease blocks these neurons from being able to do their function, which causes them to lose their function or die completely. These brain cells then lose the ability to retain memories altogether, as well as the loss of body functions over time. The constant state of rapid dying cells makes the cells not have coherent thoughts. And you can see over here how there's just a buildup of a whole bunch of proteins and fats that don't need to be there from the buildup of Alzheimer's. The neural damage of the Alzheimer's damage to the brain leads to destruction of the entorhinal cortex and hippocampus. Later stages lead to the area in the cerebral cortex being affected, which can cause language barriers, social barriers, reasonings, and memories to be damaged. Amyloid plaques are beta amyloid proteins, which people who have Alzheimer's have a high amount of these proteins clumped together. These amounts of proteins can lead to inflammation in the brain, which can cause neurons to be even more damaged. I don't know why this wasn't showing, but here's an image of it's showing up now with the activated microtubules release inflammatory cytokines and proteins. The degrading over time from the rendering neurons vulnerable to the oxidative stress. The fragments of the PNS, and then the PNS fragments become engulfed by the microglia. The long-term effects of Alzheimer's on the neural aspect of the brain. The long-term effects of the Alzheimer's on the neural aspect can cause the brain to shrink in size due to the lack of neurons and their proteins being created and distributed properly. The The brain also seems to lose the ability to process cognitive functions with the lack of neurons in the brain, which can lead to less coherent thoughts and process of thinking, which is where Alzheimer's gets its main effect from, due to the fact that people don't have the cells necessary to get the thoughts going and remembering them. Over time, the neurons die due to the cells not getting the proper nutrients they need and information. This leads to the brain shrinking and becoming less functional, which you can see in this picture. Here's on the left there's a functioning brain. On the right there's a brain with Alzheimer's. You can see a significant increase in the size of the one with Alzheimer's, and you can also see how there's a lot less coloring to it as well from all the cells dying. So it's just looking at this picture, you can tell Alzheimer's is a horrible disease. How do genetics can play a different too? Alzheimer's genes have been found to play a major role in Alzheimer's, can affect a person in a lineage of a family. APO3 to E4 is a gene that has high risk of Alzheimer's to be common occurrence in people. There's a chance of 40 to 65% of people having it. There's about 20-30% of Americans who have this gene within them and have this gene being passed down generation to generation, kind of massive influx of Alzheimer's to occur. Genetic differences within a person can vary. Alzheimer's to affects others differently at a time and different rate. There's been studies that parents with Alzheimer's who pass it down their children can be different based on their children. Children have a chance to acquire the Alzheimer's gene, or like the chance of acquiring Alzheimer's, but all of them will have it or will have different effects on them. The rate at which Alzheimer's can occur is different, and it is just, based on the individual and how bad it is. Some people don't even get it, which is an upside. And yeah, that's basically my side of the presentation.